Panic disorder in men versus women. Does it differ? Hey, welcome back to the channel. I'm Zaki, and today we're talking about something super important but often misunderstood: panic disorder. You know those moments when suddenly your heart races, your breathing feels off, and a wave of overwhelming fear crashes down on you out of nowhere? That's a panic attack. And when those attacks happen repeatedly and unexpectedly, it can turn into panic disorder. But here's the question we're diving into today. Do men and women experience panic disorder differently? And if yes, how exactly does it show up in each? Grab your favorite drink, get comfy, and let's unpack this together. You're going to be surprised at some of the things we uncover about the differences and similarities between how men and women live through panic disorder. First things first, let's clarify what panic disorder actually is. It's not just a bad day or feeling nervous before something stressful. Panic disorder is a mental health condition where someone experiences unexpected, recurrent panic attacks, meaning the attacks come without any obvious trigger or warning. Imagine feeling completely fine one moment, then suddenly being hit with an intense wave of fear that your body reacts to with symptoms like a pounding heart, chest pain, sweating, dizziness, shaking, and difficulty breathing. For many, it can feel like they're having a heart attack or even losing their mind. What's worse is the aftermath. People with panic disorder often develop a persistent fear about when or where the next attack might happen, leading to avoidance of certain situations and a significant impact on daily life. It's a vicious cycle that can be exhausting and isolating. So, how common is panic disorder, and do men and women really experience it differently? Well, studies show that women are diagnosed with panic disorder at about twice the rate of men. That's a huge difference. But here's where things get tricky. Does that mean women are biologically more prone to panic disorder? Or could it be that men are less likely to recognize symptoms or ask for help? This gap between diagnosis and experience makes us ask a bigger question. Are men's symptoms simply underreported, or do their panic attacks really feel different? Let's break down what the research and real-life experiences say. Starting with women, panic disorder often comes with more frequent and intense panic attacks. Women typically report physical symptoms like dizziness, nausea, trembling, and a deep fear of losing control or going crazy. There's some fascinating research suggesting that hormonal fluctuations, such as those that happen during menstrual cycles, pregnancy, or menopause, can influence anxiety and panic symptoms. For example, estrogen impacts how brain chemicals regulate fear and stress. So it's not surprising that panic disorder can feel especially intense or unpredictable during certain times in a woman's life. Another thing to note, women tend to be more open about their emotional and physical health, which means they're more likely to seek medical advice or therapy. This openness helps with getting a diagnosis and treatment, which can be life-saving. But what about men? Panic disorder affects men too, but the way it shows up can be very different, and sometimes less obvious. Men often experience panic attacks with intense physical symptoms, like chest pain and difficulty breathing. But rather than recognizing these as anxiety symptoms, many men think they're having a heart attack or another medical emergency. This confusion often leads them straight to the emergency room, where after medical tests show no heart issues, the panic attack might be dismissed as just stress. Another important point, men are often socialized to suppress vulnerable emotions. Instead of describing their experience as fear or panic, men might show anger, irritability, or frustration. Some may turn to substances like alcohol or drugs to numb their feelings. The result? Many men don't talk about their panic attacks or seek professional help, which can lead to long-term suffering without treatment. So why do these differences exist? The reasons are complex and involve a mix of biology, psychology, and culture. On the biological side, hormones like estrogen and progesterone influence anxiety levels in women, while testosterone may have a modulating effect on men's experiences of fear and panic. Brain differences in how stress is processed may also contribute, but arguably, social conditioning plays an even bigger role. From childhood, girls are encouraged to express emotions and ask for help, while boys are often told to be tough and keep feelings to themselves. This cultural messaging shapes how men and women respond to panic symptoms, often affecting whether they seek help or how they describe what they're going through. Additionally, there's something called diagnostic bias, where healthcare providers might be more likely to diagnose anxiety disorders in women, while men with the same symptoms might be misdiagnosed or overlooked. This makes the gap in diagnosis rates partly a reflection of systemic biases rather than pure biology. Let's make this a bit more relatable. Imagine two people, Jake and Sarah. Both are in their early 30s. Jake one day suddenly experiences a racing heart, tight chest, and dizziness. Convinced it's a heart attack, he rushes to the emergency room. After tests show no cardiac problems, he brushes it off, never mentioning the incident again, thinking it was just a fluke or stress. Meanwhile, Sarah experiences the same symptoms, but she talks about it openly with her friends and her doctor. She researches panic attacks and eventually gets referred to a therapist who diagnoses her with panic disorder. With treatment, she learns ways to manage and reduce the attacks. This example shows how the same condition can have drastically different outcomes depending on social support, awareness, and willingness to seek help. So, what can we do to help? First and foremost, we need to break down the stigma around mental health for everyone, especially men. Panic disorder isn't a weakness, and seeking help is a sign of strength, not failure. We also need to raise awareness about the different ways panic disorder can present so doctors and loved ones can recognize it early, no matter the person's gender. Creating safe spaces where men feel comfortable sharing their feelings is crucial, as is encouraging open conversations about mental health in families, workplaces, and communities. And for everyone experiencing panic disorder, remember, you're not alone and effective treatments exist. To wrap up, panic disorder affects men and women differently, but at its core, it's a condition that doesn't discriminate. Understanding these differences helps us offer better support and compassion to those struggling. Whether you're watching this because you want to understand yourself better or because you care about someone going through panic attacks, know this: mental health is a journey for all of us. If you found this video helpful, please give a thumbs up, leave a comment sharing your experience or thoughts, and don't forget to subscribe to @Zachaprat for more videos that make mental health conversations easier and more relatable. Thanks for hanging out with me today. Take care of your mind, be kind to yourself and others, and I'll see you in the next one.